This episode is sponsored in part by Real-Time CTMS, a leading provider of innovative software solutions for clinical trial research sites, site networks, sponsors, and CROs. To get a free demo, visit the company's website at realtime-ctms.com and complete one of their contact forms. Hello and welcome to the Note to File podcast, a collection of interviews, best practices, and candid commentary for clinical research sites. I'm your host, Brad Hightower. Our guest today is Arti Bhosale, a dentist turned clinical researcher. After completing dental school in India and moving to the US, Arti initially planned to continue in clinical dentistry. But while completing her master's degree, she had the opportunity to be involved in oral cancer research, and since then has made a conscious choice to continue in clinical research. 12 years have passed, and Arti has held roles at both site and industry levels. Arti is also the co-founder of Sieve Health, an AI/ML/NLP-based advanced clinical trial matching platform designed to benefit multiple clinical trial partners by enabling faster and diverse patient recruitment with enhanced accuracy. In this episode, we discuss the complexity of subject recruitment, inclusion of community practices in clinical trials, and the growing power for sites to choose their own technology solutions. Without further ado, Arti Bhosale. All right, Arti, thanks so much for coming on.
Thank you, Brad. Thanks for having me over, and it's always a pleasure to talk to you.
You're in Houston, yeah? How's the weather down there?
Oh, Houston. I mean, pretty much I like to joke that it's 2 weeks usually of spring, 2 weeks of fall, and everything else is summer.
Yeah, I lived in Austin for a while, and I wasn't even that far south as Houston, but yeah, man, it was hot.
It's hot
for
and
like all the time.
Mm-hmm. Yep. But hey, I don't have to worry about, because I did live in Calgary for a couple of years, right? I mean, but I love Calgary. Trust me. The only thing I don't miss is in Houston, you can just get up and go out. Don't have to worry about.
Right. Yeah, those are quite a two different extremes there.
Oh yeah.
Calgary to Houston.
Yes. I've lived in a few different countries, and each experience is different. But yeah, Calgary is just gorgeous. I mean, yeah.
Yeah, I have not been up that way. I'll have to check it out. Well, very good. I like to jump right in with everybody, kind of the same, and just hear a little bit about your backstory and kind of how you got into clinical research. Kind of maybe take us through your career a little bit.
Oh, sure. So no, I mean, clinical research, it's really interesting, and I think many people have this story that they accidentally got into research. And I know I've read a post also on LinkedIn about this, but it's okay. I think it's changing. People are coming into this consciously, and that's how it happened for me. Yes, I got more involved in it by chance, but I made a conscious choice to stick with it. So my background is I am a dentist. I graduated from India, and then I moved to US for my higher education. And at that time, when I was a younger doctor, I wanted, like any other, I wanted to continue in clinical practice and wanted to be an oral surgeon. So that's what I was working towards during my master's. I was working with I got a chance to work with an oral surgery group here in Houston, but they were working on a few oral cancer research studies. And that's how I got my first like a hands-on experience with clinical research. And It did resonate with me so much. And I do have a personal story behind it. I did lose my grandmother, my dad's mom, to breast cancer. And when I was doing my medical studies, my dad always, he's always shared those stories with me. And he and we are very close. And so he kept on saying, okay, you're getting into medical, see what you can do. And I was like, Dad, you cannot solve cancer, a treatment.
That's a lot
or something.
Of pressure.
Yeah, I know. So, but no, so the clinical research side of it, now it's getting, when I was studying in India, it wasn't that prominent, but it's getting there, that market too. And so, but when I got to work in clinical research here, it really resonated with me. And I made a conscious choice to kind of switch to clinical research and stay with it. And I've been in research for about 12 years now in various roles, and I have worked in different therapeutic areas like, like I said, oral cancer research, clinical psychology, cardiology, and oncology. So, I've delved into different aspects of it and in different roles. Most of them have been from the site perspective, have been in the what I like to call, the front lines basically, and dealing and
Sure.
executing the trials. So yeah, that's how it's been. And I love it. Trust me. I love working in research, and uh, the way the industry is shifting, it's just amazing. So yeah.
Yeah, it is a very interesting and exciting time. I mean, there's
Mm-hmm.
a lot of technology solutions, especially that are becoming more prevalent. A lot of people trying to come to market.
Mm-hmm.
I know that what you do now is very much trying to address one of the bigger pain points that sites have in identifying potential patients. So
Mm-hmm.
tell us a little bit about what you're doing now with Sieve.
Sure. So yeah, I am currently, serving as a co-founder of Sieve Health. And so Sieve is a healthcare SaaS platform, and it's designed to enhance operational efficiencies, primarily for clinical research sites and the affiliated healthcare providers. And so basically the way it came around to this was, like I said, I have served in many site facing roles, right? And those stories kind of stick around with you for when you've dealt with it firsthand yourself. And I like to refer to myself or consider myself operations nerd. So I've always kind of, looked at this from that perspective. I'll always like to do process enhancements, and a lot of that, like, okay, if something is working, how can we make it better? And if something is not working, what is going on and how we can do that? And I always call it lazy, but I try to look for an easier way to do it. Why not, right? You should work smart, right? So that's kind of the driving point of it. And I think I agree with you. We are in an era right now where there is a lot of technologies or technological solutions that are being developed around this. But again, we also have to be cognizant, it just sometimes it's like the shiny new toy and everybody runs after it. So,
Right.
but that's not what Sieve Health is. It's not like we have designed a technology platform and, like just trying to, sell it. That's not what it is. It was birthed coming from a pain point, trying to solve a pain point. And that is still the driver behind Sieve, and it's my personal driver, and for the team, that's what we are trying to do. And technology is just a tool or an asset to help solve that problem basically. And so yeah, we are just lucky enough to be in an era where there are options of advanced technologies, and many other industries are using it. So why not us? We should be using it too. We should figure out if, and yes, healthcare is a different species, of course I understand that. But again, that's what we have to then research. We are researchers, right? We have to figure out what is safe, what is the right way of using this, and how we can use it smartly to reduce our own burden and work smarter basically, right? For and this is again all at the end for the benefit to get those treatment options developed faster for the people that need it. I think that's what everybody's ultimate drive is. So yeah.
Yeah, I mean, and I think we're all in the industry to do just that, right? Help get treatments to patients faster and more efficiently. And it's not always clear that all the tech coming out is going to help get us there in that way. But I mean, what I love about what you're doing is, again, it's a very real and sort of in your face problem that we
Yes,
face as
exactly.
sites. A lot of times you might be waiting around to happen to catch patients as they're coming in the door. Well, like you see, that's not the smartest way to do it. That's not the most efficient way to identify patients. But because of a number of reasons, especially EMR systems not being particularly that intuitive or easy to query patient data out of,
Mm-hmm.
especially if you're a just a research coordinator. He may not have
Yes.
access to some of the tools that, somebody a little more high up the chain in an IT might, but your platform really provides a way to filter that data out in a meaningful and useful way
Mm-hmm.
for the coordinator. So, I mean, how's that done? Is that just sort of is that a backdoor plugin, or can you tell us a little bit about kind of the process of how that works?
Sure, sure. No, definitely. And so, yes, like you mentioned, Sieve focuses on trial enrollments. And we have a focus on diversity in trial participations and increasing the access to trial as a care option in the community, basically. And so where we fit in, I think Matt had mentioned this before, and I'm going to take the same example, like that 70-30 kind of ratio, right? The sites kind of enroll almost 70-80% more from their own database, or the physicians or the providers that they work with, right, from within those EMR databases. And then 30% is coming from these marketing and outside leads and all of that. But either ways, figure out this way, like you mentioned, the leads that are coming from outside, they are self-reported, they are based on a limited information. So the conversion rate for them actually getting into trial might not be that straightforward. And the CRCs who are scanning through the database for figure, because clinical trial enrollment is not just one step, it's a process. It involves many different steps involved, one after another, and this is what people don't understand, basically. And people who have been through this firsthand, they understand because they have been through. And so it's that's where it is, like, think we need to focus more on that and not just discard it as that, like, just finding the patients. It's not just finding the patients.
It's a lot more complicated.
Yeah.
Well, and it's something else I really like about this concept and the platform is that you're also providing a way for maybe physicians who aren't directly related, aren't directly involved in research. Maybe they aren't a site, but they can start to contribute to the research landscape by providing patients and look, that, like you said, that's a process, and that involves potentially a lot of things as far as educating patients, but you got to find them.
Exactly.
You got to narrow the funnel a little bit, because a lot of what we do, I feel like at the site level, is it's not smart. It's just brute force. It's talk to as many human beings as possible and hope that 1%
Yeah.
are qualified and interested in being in your trial. And if you can narrow that funnel, again, even a percentage, that's going to create a lot more efficiency than what we see now. But again, I love the idea of how we can potentially start to introduce physicians to the research process by this method.
Yeah. So couple things here. I mean, Brad, you touch point, like you hit the nail on the head by saying that the funnel effect, right? So I'll start there, and then I'll jump to the affiliated physicians, or how to enable other physicians. So the funnel effect, yes, you're very right. It's such like I said, it's a process, right? Trial recruitment, it's a process, it's a workflow. Things happen one after another, but it's mainly a manual process. And that it's administrative process. Guess what you're doing? You're putting these clinical hands, or heads in that, and they get bored. Trust me, they don't know. They would rather do the patient facing, they want to do patient care, and all of that. But if they are stuck doing administrative, it's just it takes the interest out of and guess what, if those people are not interested or doing feeling the urge to do it, the trial moves farther away from that intended patient. So that's where Sieve comes into play, is we have automated those processes of manually going through the charts, and there is no way, for example, if there are 10,000 patients at one site, how are you even possibly going to go through those many? There is, like you said, there is no easy way of querying the EMRs. You have to do it one at a time. I have done it, trust me, it's not easy. And that's where I had first thought, there has got to be an easier way to do this. So guess what, I mean, I couldn't find it, so I designed one. So I mean, yes, there are others that are designing this too. I think as an industry, we are recognizing this, that this is a problem, because we've been the evolution that I like to call of trial enrollment, solving the problem of trial enrollments or the lack of them. It's been like, okay, we are going to work with bigger hospitals. Well, no, that's not enough. Let's what do we do? Oh, let's add more sites without any any preview or anything. Okay, more sites. Well, it's still not working. What's happening? Well, let's market the study, and everything gets leads from outside. It's just finding the patients. Why are we not able to do it? It's still not working. Why? Because there is another something else going on. It's a root cause analysis. That's what we did. And over my period of experiences and my research, this is what I learned, that it's that administrative burden on the sites. It's not humanly possible to do. And imagine how much is coming towards sites way in this era, the shifting landscape and the surging demands, because sites are the one who are executing these trials. Even if it's going sometimes directly to patient, the information, it's still coming back to sites, right? They are the one executing the study team and everything. So whatever we can do to reduce their manual administrative burden, we want to. And that's what Sieve does. It provides an end-to-end recruitment, like patient finding is step one, but a management platform. So it's an end-to-end solution, basically, just to automate and digitize those manual processes. And it's just, we have had a good success with it. Our sites that have used it, they have been really happy with it. So that's the driver, right? That we can solve the problem, and it's an immediate problem. Like it's really in your face. And then the second part of it, the cool part of it, is that enabling community physicians, or like, because I think I had read Craig had mentioned this somewhere, like enabling the physicians to enroll patients into trial is the holy grail, right? Of trial and error. So I mean, but how do you do that? Like, if you go and talk to a physician, or if you just put the burden on them, like, hey, refer the patient, is still putting the burden on the physician and his staff or her staff. Like, find the patients, you figure out how to find the patients. Well, no, nobody has time to do that. And we gotta recognize and accept that everybody is human, and if there is just too much to do, people are going to have priorities. So what if we can automate parts of it and help that way? And that's what Sieve does. And we have had, there is the physicians, they want to do this, the providers and everything. It's just that they need help figuring out how to do that. So
Well, yeah, and that's what I think is interesting, and you kind of touched on there, is about the concept of doctors enrolling their own patients in trials.
mm-hmm.
And I think this takes us a step closer to that.
Yes.
In conjunction with some other things going on in the industry, I think. So this is, again, a particularly interesting and exciting solution, because, again, when you think about it, if you've got groups like, well, I'll plug myself, groups like me who want to go out into the communities and set up sites, but then you can also create a very robust referral network,
mm-hmm.
or whatever you want to call it, a hub and spoke model.
Mm-hmm.
I've heard it referred to in different ways, but
Mm-hmm.
at that point, your reach increases dramatically, and you solve a lot of the problems we currently have, which is, if I go down the street and get someone to agree to refer patients to me, it's like you said, someone's still got to find them.
Yeah.
And it's likely not going to be that doctor, because there's a reason that they're not already doing research, because
Right.
it's a pain. It's a lot of extra work.
Right.
I mean, any number of reasons.
Mm-hmm.
But now you've got a process by which I can go to that doctor and say, look, here's 100 patients of yours that fit this particular trial. So let's get them on board. Let's offer that to them. So again, I think what you're seeing could potentially exponentially increase the number of patients we can reach, and
mm-hmm.
again, make site operations a lot more efficient. And I love that it is, at least to me, it appears to be a very site focused platform, because, like you said, I think it gets lost sometimes in the discussion that sponsors can have all the ideas and all the solutions that they want, but they can't enroll a patient. They can't go enroll a patient in a trial. It's got to happen at the site.
Mm-hmm.
So I think that I really appreciate that fact, that it feels like it creates some ownership, so to speak, or at least some ownership of process
Mm-hmm.
for the site level, And I think
Yeah.
smart sites want that,
Exactly. And I couldn't agree with you more. I mean, because again, this is what I have observed from talking to different, people. I just, I love talking to different kinds of people to understand different perspectives, because I'd like to understand from other perspective and everything. So, and from my observation, what I have seen is, of course, there are different stakeholders, you are aware of that. But the study operations, like, when you refer to study operations, it kind of, or most of the advances have been on, there are two aspects to it. There is a sponsor CRO study operations aspect, and there is a site study operations. But what happens is, most of the time the focus goes on the sponsor CRO side. I mean, they have been proactive, and all the technology advances have been more from that side. And then guess what, the sites are feeling like, hey, no, you guys are designing everything and then putting on us to implement it. We are getting burdened and everything. So that's why, no, Sieve is, you said it right, it's site focused. It's coming in from that angle. And there are few other platforms which are like, and I think, yes, it is time for sites to also think about this in that way. And take, because this will allow them to take ownership of their own operations and their study management. And yes, C focuses on enrollments, but there are other platforms who help you, and you can standardize your processes. I'm a big fan of process standardization, like not to the T, and like where not it's adjustable at all, but if at least the overall backbone is kind of standardized, it helps you manage that load much more efficiently. You can do your processes much more efficiently, and it leads to trial success ultimately. And that kind of keeps the people going, yes, this is working, I want to do this, rather than just, oh my god, I have to do this also now, and this and this and this. So that's what I envision is, the way sponsors and CROs have this plethora of solutions or platforms to manage how they want to manage their study. Sites should, research about this and invest into this, and focus on this too, because this will help them have their own toolbox of how to manage site operations much more efficiently. And it's just an ultimate benefit for everybody. Basically, the sponsors would be happy too when the sites are performing, and the sites would just be would be doing what they are wanting to do, provide the solutions or the treatment options to as many patients as they can, and just enjoy the journey basically.
Well, and again, that's what, initially I think myself and probably other sites have been, I don't know, we get nervous to see all these new solutions coming to the forefront because we just see, oh no, more platforms to log into. But I mean, I agree with you. I think the part maybe wasn't originally clear to me that I think maybe is becoming more clear is that I think sites will start to have more of a role in choosing their own solutions. Like you said, I mean, I don't need to, I don't need to take cold leads, from a central campaign. If I can go identify a bunch of patients in my community very easily and efficiently, right? And then at that point, the site gets a little more leverage to, do things the way that they want. And I think this is a perfect example that is a win for everyone. And really nobody can argue with either. I mean, if it results in more patients put in more efficiently,
Exactly.
I mean, I don't think anybody's gonna argue. And in the transparency, I mean, I've seen your platform. I do love the concept. I love it.
Yeah.
I want to point out too, like you said, identification is the first part, right? But then you've got to manage that patient through the process, and it's something that's baked into the platform as well. Yeah.
Yeah.
So again, I like that. I think that's sometimes lost on people, or it can be challenging for sites too. If you get, handed referrals randomly from a bunch of different sources, and then pretty soon you're like, okay, where did this come from? And
Exactly.
where are they? Have we called them? Where are we at? And Sieve has that built in. Yeah.
Yes, exactly. It has it built in. And because, like I said, trial enrollment is not one step. It's not just finding the patient. Like, that's kind of the step one. And even like that. There's an entire process that comes after that. You have to track and you have to figure out, and what's like pre-screening is one, and people just kind of undervalue it too much. And but that tracking mechanism, and what happened, and figuring out the tracking and process standardization helps you also understand the bottlenecks. Everybody feels the bottleneck, but it's not many people put effort into, okay, where is the bottleneck, what is happening. And it could be different for different sites or different groups, right? So you got to figure out what. So that's what Sieve helps to do. It lets the sites individually find their own bottlenecks, like what is happening, and they can focus on those basically. And so it's just it's the same process. And again, that's why our sites kind of love that, because they don't have to relearn something. Because most of the time technology, and like you pointed out, it's scary. And for sites it's been like, no, one more platform, no, don't tell me about that. But it's it's not that. That's what. And it's part of kind of just having an open mindset, all of that. So the way Sieve is designed, it fits into your existing process, existing mold, because not everything needs disruption all the time. Sometimes you just need an optimization, right? So, and that's what Sieve does. Okay, you're doing your own process, that's great. Here is a smarter way to do it, and easier way, a centralized way to do it. And guess what, it will help you figure out how you are doing things, and where you could okay, kudos on this one, but maybe you could switch something here and it will help it get better. So that's what Sieve does. And so we are hoping, like, it's really coming, the way it was initiated was from the aspect of trying to solve that problem. Like I mentioned, I always like to do that problem solving, and I'm a very process focused person and operations, because yes, we can design everything and all of that, but it boils down to those nitty-gritties of those operations. How are we going to do it? What is the best way to do this? What. And I like to have a structured approach. Like, I don't like to, like, let's play it by ear. I mean, sometimes that's fun, yes, but in certain situations, otherwise, a structured approach is, I have seen it having more success. So,
well, and ultimately, look, this is to me, at the site level, this is the most important part of what we do. I mean, identifying and getting patients enrolled, because frankly, you can't keep your doors open if you can't enroll patients in trials, right? So this is possibly the most urgent need any site can have, which again, I love, because like you say, I don't know that every new solution coming out is necessarily a solution to anything in particular, right? It's sort of it's not so much process as it is just design, right? Look at the cool, shiny thing. Well, okay, does it help me enroll patients in trials and retain them? If it doesn't, then why? Why are we doing it? So again, I do very much appreciate that this is if not the most, one of the most, addresses the biggest issue that sites face. So I love that. I want to shift gears a little bit. I always like to kind of shoehorn this question in, because I personally find it interesting, but I always want to hear about what kind of tools and resources people use, whether it be an app or a podcast or a book or anything that helps you do your job better. What's maybe something you'd share with the audience that you use and utilize? Sure.
So I'm a reader. I have loved to read, ever since I was a kid. So I come from a family of voracious readers. So reading is what always have been my go-to. So I don't have too many like fancy options to suggest, but I mean, yes, Audible, that's what I use. I mean, that's my go-to, and podcasts. It's my go-to. I just love doing that. But in my experience, the few tools that have helped me are having some kind of, I use certain app for to-do list, but it helps basically to keep track. And like I said, I'm a structured person, like this, and okay, let's do this, chalked out.
Can I ask what app you use? Because I feel like I struggle to find something that works really good for me. I've been using Todoist lately, but I know there's a ridiculous amount of options out there.
Oh, trust me, it's one of my pet peeves. There is just too many options out there. It's so difficult. And I'm like, okay, keep it simple. Just, give me what. And I'm not a Luddite, but I like paper and pen. But no, I've tried to shift more into like, everything on your phone, the word. So I use the to do cloud. It's a very simple one, but it lets me add really faster, and chalk out things faster the way you would do, on your notebook. And, it just lets you set reminders and everything like, okay. And it's for me, the to-do list is just keeping track and all of that. So that has helped me in my project management experiences and all of that, or just to look at the overview. Smart sheets have been helpful. I know it requires license, but it's a really cool tool. It's Excel on steroids, so I have
Nice.
loved Smartsheet. They are really good. And if you are a reader like me, but you don't have time, like like me to go, I would love to just read all the books, but guess what? There is a life happening. You have to go and run around after the kids and run a business, all of that, and everything. So you don't get time as much to read. So there is this app called Blinkist. I don't know if you've heard of that.
Heard of that.
Blinkist. Blinkist. So what it does, there are, I think, few others, but I like this one. It shortens, it gives you a summary of a book. And it's so much like, you have so many on your list, right, to read, but you don't get time to do that. And it's also actually a good way of previewing, like, should you spend 7-8 hours in reading a
Right.
book, if like, so I like using that one as well.
No,
It's been
that's
helpful.
awesome. I drive a lot, so between sites, so I
Yes.
listen to Audible a lot. But it looks like Blinkist is like
Yes.
Cliff Notes almost for books. So that's actually awesome. I'm going to check that out.
Yeah, so that's what I do. Yeah, like I love listening while traveling, and so Audible and podcasts are my, Apple Podcasts. That those are my go-to apps. But I start with Blinkist. Like, I have a short list before I jump on Audible. I was like, okay, let me test the waters, kind of
Right,
thing.
right. No, I know. I love that. That's I'm gonna check that out. I'm excited that you brought that up. Thank you. Well, very cool, Arti. Where can people find you online?
I am not too many social media platforms. You can find me on LinkedIn. I'm very active on LinkedIn, and so that's where you can find. That's the easiest way to find me.
All right, very good. I'll make sure that we post your info on the show notes on our website. And anything else before we go?
No, I just kind of, as a parting note or something, it's sites is an important stakeholder, so always keep looking at the bigger picture. Put yourself in other shoes, understand where the expectation is coming from the side, because sometimes that's helpful too, and active listening. And just make a long-term plan. Yes, it's very easy to get bogged down by short-term issues and all of that, but look at what's going on, the bigger picture, and just keep an open mindset. And that's it. Just keep doing what you're doing. And it's the end point I like to keep in mind is the end goal, where bringing the advanced therapeutics, faster to market, or so that people in need can really have them. That's my ultimate driver, basically. So yeah.
No, that's what it's all about. Arti, thanks so much for coming on.
Of course. Thank you, Brad.
All right, we'll talk soon. As always, thanks so much for listening to the Note to File podcast. Please make sure to rate, review, and subscribe, all that fun stuff. Make sure to check us out at notetofilepodcast.com, where you can see episode transcripts, show notes, and our guests' contact information. Thanks again.